All right, the next bill on the calendar is House File 3812. It's a Chair Aiken bill, and I will move that House File 3812 be re-referred to the Committee on Judiciary, Finance, and Civil Law. Welcome to the committee, Chair Aiken. And first, before you present your bill, I do believe that we have an author's amendment, and I will move the A1 amendment to get the bill in the shape the author desires. Did you want to speak to the amendment now, Chair Aiken?
Thank you, Madam Chair and members. I think we can just speak to the bill language when it's after it's amended, please.
All right. Any discussion to the A1 amendment? Seeing none, all those in favor signify by saying aye. Aye. Opposed? The motion prevails and the A1 amendment is adopted. Chair Aiken, go ahead and explain your bill as amended, please.
Well, thank you, Madam Chair and members. This is my first time to the Public Safety Committee, so this is very exciting.
Welcome.
Thank you. Appreciate the opportunity to present House File 3812 as amended. We're looking for a change to the statute 604A.05, which is a Good Samaritan overdose medical assistance statute. I'm working on this bill with Colleen Ronnie, Executive Director of Change the Outcome, which is a nonprofit she started after losing her son Luke to an overdose. Currently, overdose is the #1 cause of death among young people. Colleen works in schools and communities to educate students, teachers, parents on the important aspects of opioid use, the disease of addiction, and emerging drug trends. Last year, we successfully worked to get naloxone in schools, and I've been told that it has saved several lives already this year. Colleen came to me this year with a concern about the Good Samaritan law for overdose and how it impacts young people who often use drugs in group settings. Our bill today looks to expand immunity from just the first person to call for medical assistance to those acting in concert with the person seeking medical assistance. This change brings this statute in line with the existing language in the sexual assault statute, and would give young people the assurance they're looking for to call for help in case of an overdose. We met with representatives from the County Attorneys Association, who I see in the room, and they're here today and may want to share their perspective. In short, they voiced their support for the intent of the bill and are here in case we have questions for them. But with that, Madam Chair, I will turn it over to my testifier, Colleen Ronnie, who can do a little better job of demonstrating the need for this bill.
Thank you. Welcome to the committee. Please introduce yourself and begin your testimony.
Thank you. Good morning. My name is Colleen Ronnie, and I'm the Executive Director of Change the Outcome. As Patty said, Rep. Acomb said, we deliver school-based prevention education related to the fentanyl epidemic that is impacting young adults across the state. There are many aspects of the law that need to be addressed, but today we are just seeking one change, one adjustment that will save lives and prevent additional public safety issues. In our work, we've presented our program to more than 80,000 middle and high school students, and we've learned that young people are afraid to call 911 to get help for someone experiencing an overdose, despite the protections currently provided in what is commonly referred to as Steve's Law. The current iteration only provides protections to one person who calls 911, just that person, nobody else. We have students who are actually doing the math. They are asking us how long they'll go to jail if they don't call for help. We're also hearing that when someone calls 911, others will quickly leave a gathering despite possibly being impaired because they don't have the protections the caller has. This obviously leads to other public safety issues that can have dire consequences. I've spoken with law enforcement officers from jurisdictions across the state who, in referencing the law, believe that this adjustment to the law to protect more than just the caller would be a good thing. It would make the law clearer and it would save lives. There have been tremendous shifts in attitudes in how to best address the opioid epidemic since the law was enacted 10 years ago, which indicates a strong support for the change we're seeking. It would also eliminate unnecessary drains on the times and resources of law enforcement, county jails, and prosecutors. Ultimately, the change we're asking for would save lives, which I believe is something we can all support. Thank you.
Thank you, Ms. Ronnie. And I think I can speak on behalf of the entire committee that we really appreciate your dedication to this issue and recognize the lives that you have saved as a result of your advocacy. So thank you. Do we have any other members of the public who wish to testify on this bill? All right, I'm not seeing any member discussion. Representative Ingen.
Thank you, Chair Moeller, and thank you, Representative Acom. I really think that this is a great bill. You've obviously put great work into it, and thank you so much to the testifier who's sharing this story. It takes a lot, and you've worked on this. The only question I have, I think right now we have an effective date of August 1st, 2024. Is there any, and this is just a suggestion, is there any possibility that we could have immediately upon passage?
Chair Acom.
Well, I wouldn't be opposed to that. Are you offering an amendment?
I don't have one in front of me, but after this, yeah, that'd be great.
Yeah, and I'll just note too, it's going to judiciary. I think sometimes there's a little bit of a delay just so they can get the statute books updated and people aware of the changes. So I think that's a discussion that we should have as the bill moves on to judiciary, but thanks for the suggestion. Okay, hold on one second. No. Okay. All right, any other member discussion? Lead Novotny.
Chair Moeller, I just have a question for the County Attorneys Association. Looks like they're here.
Sure, yep. I think I see Bob Small coming up to the testifiers table. So thanks for your hustle, Mr. Small. We appreciate that.
I know
You
you're on
want to
time limit.
introduce yourself and then Lead Novotny, you can ask your question.
Thank you very much, Madam Chair. My name is Robert Small. I am the Executive Director of the County Attorneys Association.
Thank you. Lead Novotny.
Chair Moeller, Judge Small, just a quick question. Does the County Attorneys Association have any concerns with this or the original language? And does this amendment address all of those?
Judge Small.
Chair, Representative Novotny, we've been in contact. We've had some very good conversations. We appreciate the representative's opportunity to bring us into the fold. We have suggested some little bit of a tweak.
That is an image now I cannot get out of my head.
I am so sorry, members.
No worries.
And I think we're working on that. But
Yep. Lead Novotny.
Thank you, Chair, and thank you, Mr. Small. And will they come back to me before we vote?
Sure, we can. I don't know if we have any other member discussion,
Well, let
so
me just-
go ahead.
With the theme I've expressed to you in the past, there can only be one primary concern, and with the sanctity of life being the most, and the protection of life, this is the most important thing we can do, and I urge my members to vote green.
Thank you. Any closing remarks, Chair Acom?
Thank you for your support, and as we will see about the suggested changes as this goes to judiciary.
With that, I renew my motion that House File 3812, as amended, be re-referred to the Committee on Judiciary, Finance, and Civil Law. All those in favor signify by saying aye. Aye. Opposed? The motion prevails.
Thank you, Madam Chair.